The NHS spends a lot of money on medicines, and of course it is one of the ways in which it provides care to people. How it does so in a way that is efficient and produces the greatest outcomes is an area of constant investigation for the service. So it's been great to have a whole day dedicated to exploring that question. There is a lot of focus on the cost of medicines at the moment. Specialised commissioning spend alone is £25 billion every year. The savings that could be delivered if medicine optimisation was achieved to the greatest degree is £7 billion a year. These are big sums of money. This is an important area.
Events like these have lots of people coming to them. ICB chief pharmacists through to financial directors, as well as those working in industry. So I was in a number of sessions. One really focused on specialised commissioning, which looked at some of the delegated responsibilities when it comes to specialised commissioning. How are ICBs going to deal with that? What is the training, competence and infrastructure needed for delegated commissioning in the specialised commissioning domain? And more importantly, what does it mean from a financial point of view?
I've been part of a panel on medicine's value, and the panel had a really good discussion about what actually is medicine's value. It's about looking at the outcomes that those medicines are producing, what that means to the patients, and also how that feels in the healthcare sector, providing that medicine as well. We talked about how people perceive their medicines, what they're doing for them, how they're working, and also how the pharmacy profession can support them much better to do that.
My first session was a round table talking about genomics and the impact of genomics on pharmacy practice. My second session was a panel about population health management, the data, health inequalities, and how pharmacists can support the population health management in our day-to-day work. I think people should take away the importance of changing our mindset to collaboration rather than just commissioning and providers. The best way to make improvements is how we work together in that integrated fashion, because medicines cut across the patient's journey. The patient has them for life, so we have to collaborate in that same way.
The pace of change in our work is so rapid at the minute that it's really important that we get together and share some of our experiences and talk about how we're dealing with some of those really significant issues. To do it in this sort of environment allows a depth and a quality of discussion that you wouldn't get through lots of other means. Some of my peers that I'll be meeting here today are people that I already knew. A lot of them have only met virtually before, and you get a different quality of conversation when you meet face to face. There are some people who are new into the system, so I'm looking forward to meeting and catching up with them. So it was worth me travelling to London for this.
If you want to support the NHS to meet the challenges that I've described, then you need to talk to the people who are influential in this space. Those people will be attending the HSJ Medicines Forum.